Well, good afternoon, everybody. As Julie said, my name's Lori Campbell, and I work at Southern Maine Agency on Aging. We dropped the area agency, the area part, some years ago, but because it's just a mouthful. Yeah. But anyway, that's okay. We answer to anything really. And I work in our family caregiver support program, where I'm mainly working with families to try to access resources and create a plan for the future for an older adult that might be getting care at home. But I'm hoping that I can answer some of your questions about accessing home care, and I really would like this to be very informal, so I don't mind if you want to interrupt for a question. Since I'm the only one with a mic, I guess I'll repeat the question back and then try to answer it for you. So this presentation will discuss home care resources which may be available to you or to a family member as you plan for your future or their future. So what to consider when you're starting to think about this? Well, what kind of care do you think will be needed? How will it be funded? Of course, that's a big one. How do you pay for it? And do I need to plan ahead? And the answer is yes, mostly. So there are different levels of home care and different ways to pay for it. As you probably have seen in recent news, there's also a shortage of home care workers in Maine, making access to care even that much more difficult. And there may be, and very often are, waiting lists for state-funded home care. So planning ahead really is crucial. I know it's hard to think about what it might look like in 2 years, 5 years, 10 years, but if you can at least start thinking about that and being proactive, that's going to stand you in good stead going forward. And when I say think about what you will need, it can be you yourself or it could be a family member. So what kind of setting do you wish to live? In what kind of setting do you wish to live? Has your home been evaluated for safety and security? And how will you access the services that you may need to remain independent, both now and in the future? So studies have shown that 96% of older adults in the U.S. would like to remain in their own home. Not surprising. I think, just about everybody would like to be at home if they can. It's an understandable goal, but it is one which requires thinking ahead. If your goal is to be at home as you age, your job, starting right now, is to think about what services and supports you may need in the future to make that desire a reality. Start now to research what is available to you based on health conditions, financial resources, and other factors that may be significant to you. Okay, this is one that we get a lot of. So before I even launch into home care itself, I really want to take a few minutes to talk about the differences between Medicare and Maine Care. And it's very confusing. There's lots of misinformation out there. And it doesn't help that they sound kind of similar. I really wish Maine had come up with a different name for Maine Care, which is our Medicaid program. But they didn't, so they do sound very similar. So basically, Medicare is the federal health insurance for people 65 and older, or younger if you've been disabled for a period of time. It's paid for through your payroll taxes during the years that you work, and generally covers 80% of hospital and medical bills. It does not cover long-term stays in facilities or a whole lot of home care, and we'll get into that a little bit more in just a bit. Maine Care is the Medicaid program in Maine. The person must have limited financial resources. Financial eligibility is determined by Department of Health and Human Services. So people call us thinking we're going to tell them you're eligible, you're not eligible, and we can't do that. We can give them an idea of what the guidelines are for income and assets, but you have to go through Department of Health and Human Services. It can cover long-term care when other financial resources have been exhausted. So it really is meant as a safety net for folks who have depleted their own financial resources. Did you have a question? Oh, I thought you okay. You're nodding your head, yeah. Yeah. So much to the surprise of many people who call in are very surprised to learn that Medicare is very limited in the amount of in-home and facility care that it covers. It generally covers temporary skilled care. That's physical therapy, occupational therapy, speech therapy, a nurse in the home or in a specialized rehab facility when ordered by a physician to address a specific medical issue. So oftentimes, let's say somebody falls and breaks a hip. They're in the hospital for a few days, then their doctor says, well, we think you should go to rehab. So they go to a rehab facility, and generally Medicare covers about 21 days. That can be extended with a doctor, having input on that, and if the person is progressing toward a goal of rehabilitation, but it is not guaranteed that it's not guaranteed that it's any length of time, really. I mean, Medicare at any time can check with the facility, find that the person is not making progress, and say, okay, we're not paying anymore. And then usually you have 48 hours to either go home or figure out long-term care. So it's really a very temporary, time-limited benefit. It generally does not cover ongoing non-medical home care or long-term custodial care in a facility. So again, Medicare will cover some home skilled care. Say you are in a rehab and your 21 days are up and you're doing pretty well. You're going to go home. Usually Medicare will follow you for some additional PT, OT, that kind of thing. A home health aide can be involved to help with bathing if one of those other services is involved, but only during the time that Medicare is in there for the skilled care. And then as far as long-term care, so when I say long-term care, custodial care, I mean, living in a long-term care facility, an assisted living facility or a nursing home. Not for rehab, but if you need to be there long-term, Medicare does not cover that at all. Medicare supplements. So many people have a supplement that covers the 20% that traditional Medicare doesn't cover, or they might have an Advantage plan. And Mary, you know all about these. But those do not generally cover home care either. Although some Advantage plans advertise that they do cover some home care, but it really is important to check the fine print of your policy and talk with your insurer, because what's on paper isn't necessarily what is the reality. Some places in the state don't have home care agencies that are willing to work with the Advantage plans, for instance. So, they may try to get you by saying, 35 hours a week of home care, but then in reality there are lots of hoops to jump through, and you may not be able to find an agency that works with your plan. So it's just important to check ahead on that. So Maine Care Maine's Medicaid program, is a combination of state and federal funding that helps to pay for in-home or facility care when the person has very limited income and assets. For instance, a person is allowed only $10,000 in liquid assets under the Maine Care program. So they have to spend down everything else they have and get below that $10,000 before they'd be eligible. Most home care and facility care is either paid for out of pocket by activating a long-term care insurance policy, through the Veterans Administration if the person qualifies for that, or by accessing one of the state-funded programs if the person's financial resources are limited. Many, many state-funded programs and long-term care facilities which accept Maine Care have long waiting lists. So again, crucial to plan ahead. Get people on waiting lists. You can always say no if it comes time, they say they have an opening and you're not ready, the person's not ready. But you may be on a list for even years in some instances, depending on the facility. I know, it's pretty crazy, but these long-term care facilities have limited numbers of Maine Care beds. I mean, if they took everybody under Maine Care, because the reimbursement is so much less than the private pay rate, they probably wouldn't be able to stay in business. So they have to balance private pay versus Maine Care. And this slide is just, pretty obvious here. So, in making a plan, you want to gather information, which is what you're doing right now, formulate some options, evaluate the options, create a plan, act on the plan, and then you're going to need to continuously reassess. Is the plan working? Because what's working today may not work 6 months from now. So it's a continuous reassessment of what the needs are and is what you have in place meeting those needs. So as far as assessment goes, what to assess, whether it's yourself or someone else. So you're going to want to assess the person's physical health. What are they dealing with as far as physical challenges? Cognition. How is their brain working? Are they able to make decisions on their own? Are they able to follow through with plans? Mental and emotional health. I mean, certainly, I think since the pandemic, we've seen a real increase, or maybe it was always there and it's just more obvious, of it's particularly older folks who are very isolated, quite depressed, those kinds of things. So you want to keep an eye on that. Self-care, are they taking care of themselves? And are they able to do that? Meals, is the person able to get their own meals, or do they need some assistance with that? Shopping, errands, chores, these are what are called IADLs, Independent Activities of Daily Living. So it's not the personal care, it's sort of all the other stuff that you have to do when you're living at home and you're trying to keep a house going. Money management, how is the person doing as far as paying their bills on time, understanding a budget and how they need to pay things and that kind of thing. Driving and transportation, and that is a huge one that we hear about all the time. Unfortunately in Maine, even Portland doesn't have great public transportation, but certainly in the outlying areas it's pretty non-existent. And so if you don't have a car or you can't drive, it's really, really difficult. I mean, there are some public transportation programs, regional transportation, York County Community Action, those kind of things, but they don't always go where you want them to go or when you want them to go. So it can be a real issue especially if you live in Leamington or Acton, and you don't have a car or you can't drive. So that's something to think about as you think about for yourself or somebody else what you might need. It's important to regularly assess how you or the person you're caring for is managing all of these areas of daily living. If the person is experiencing difficulties in one or more of these areas, it's time to consider outside assistance to help the person remain as independent as possible. Especially if you have concerns about somebody's cognition, it's important to arrange for a complete medical evaluation to try to figure out what's going on. Not everybody who's experiencing changes in their thinking processes has Alzheimer's disease. That's what people fear and jump to that conclusion. But there are really many, many diseases and conditions that can change an older person's cognition. So it's important to have a doctor try to figure this out. I remember years ago now, I had a woman call and she said, my mother has Alzheimer's disease. And I said, oh, okay, she's been diagnosed then. And she said, well, no, but I went on the internet and she has all the symptoms. I'm like, oh boy, please have her go to see a doctor before you decide that that's what she has. Many conditions common in older adults can be treated and possibly reversed, so it's important to get that thorough medical workup to understand what's truly going on if you see that someone is struggling in any of these areas. Don't ignore symptoms or let the older person downplay changes or try to diagnose themselves. So not only should your daughter not be diagnosing you, you shouldn't be diagnosing you. Let the health professionals do that. And now now that we've talked about sort of the big picture, I wanted to speak a little bit about different home care options. I mean, that was what I was asked to do. So first one is friendly visiting or a check-in. Not really home care, but I think it's like the beginning of getting some outside eyes on. So these programs help with that all-important socialization for older folks, connecting them with their community. And as I said, particularly during the pandemic, we just saw a huge increase in the number of people who were just reporting to be so isolated. The Opportunity Alliance has a senior companion program for both York and Cumberland counties, and they recruit older volunteers to visit older people in their homes, providing companionship at no cost. The volunteer actually gets a small stipend, but it costs nothing for the person who's being visited. The volunteers may be able to help with small tasks like sorting through the mail, but they're not able to do any homemaking or personal care. And often they do have a waiting list, depending on where you are and the availability of volunteers. But it's certainly worth looking into if you're just looking for, grandma needs, would like to have somebody come visit once a week and play cards or just talk about the weather or whatever. Southern Maine Agency on Aging has a phone pal program that's becoming more and more robust. It started with just for our Meals on Wheels clients, but it's now been expanded, and we certainly try to find a volunteer for anyone who would like a phone pal to check in over the phone about 1 to 3 times a week, depending on what both parties would like. So it's kind of just a nice way to connect with another person over the phone. Many age-friendly programs are now offering volunteer-friendly visiting. I don't know if this group is to that yet, but in other towns they do have a group of volunteers that might do some friendly visiting. One that I didn't even think about, but I'm going to add is the Vet-to-Vet program. So that is it actually started at our agency quite a number of years ago now. And It matches veteran volunteers with older veterans who live at home. And they try to match them based on the branch of the service that they served in or some other thing that they have in common. So that, and it's, again, friendly visiting, but with that sort of shared experience. Many local police stations offer what's called a triad program. And to be honest, I don't even know what the initials mean. But basically, the older person registers and agrees to call into the police station before a certain time in the morning. And if they don't, the police will follow up and make a welfare check to make sure the person's okay. So if that's available in your community or the person's community, and you might be concerned about them being laying on the floor or something when they get up in the morning, they might benefit from that. So these are all things that are no cost, sort of very no physical care. It's all, socialization. And then sort of one step up from that is homemaking services. So help with tasks such as laundry, shopping, meal preparation, and house cleaning. So those IADLs, but no personal care assistance. And this is often what people start with. And I think it's a good way to introduce home care into the house, especially if the person is reluctant to accept personal care services. Maybe you start with homemaking, which is a little less intimidating, I think. Get them used to that, and then maybe you can get some personal care in after that. So that this first level of in-home care involves these tasks, but health insurance does not cover these types of services at all. Person can pay privately through a non-medical home care agency. They can, maybe there's someone in their community that they know of that comes in and does cleaning and other household tasks. Or they can try to access the state-funded Independent Support Services program through Catholic Charities. So this is a state-funded homemaking program, but it doesn't come under the Maine Care program. So it's not sure how it's funded exactly, but it's funded with state funding rather than Maine Care. To be eligible, you have to need assistance with 3 out of 4 IADLs, so laundry, housekeeping, grocery shopping, or meal preparation, so 3 of the 4 of those. They do look at liquid assets, must be less than $50,000 for an individual, $75,000 for a couple. A person can get 2 hours a week of a homemaker if they're single, 3 hours if a married couple. So it's not a huge amount of service, but it's something. Unfortunately, right now there's a statewide waiting list based on the availability of staff in a particular area. So I can't really say, there's a 2-year waiting list because it depends on where you are in the state and what kind of staffing is available. If you need this service or think you might in the future, it's worth it to at least get on the waiting list. I mean, it can't do any harm to just call and get on a waiting list. There is now a self-directed option where a person can have a friend or a family member or some other trusted person perform the care. And then the person who's getting the homemaking service gets reimbursed at this point in time, $17.69 an hour to pay the person directly. So, they get the money and then they pay the person to provide the care. And there also is a $5 per hour co-payment. So a lot of these home care programs aren't free. They do have a co-payment of some sort to offset some of the costs. So the next step up from homemaking services is in-home care. which can be paid privately, state-funded home care programs, the Veterans Administration home care program, or possibly long-term care insurance. So this level of care is provided by licensed non-medical home care agencies, and it's aimed at people who need help with personal care, or what's called ADLs, activities of daily living. So bathing, dressing, locomotion, toileting, those kinds of things. Once again, this type of care is really not covered by Medicare except for a very temporary period of time if there are physical therapy, occupational therapy going in. And we're going to go through these one at a time because this is the one we get the most questions about. All right, private pay, non-medical home care. When I say non-medical, I mean these services are acquired through agencies that do not have a contract with Medicare. So some home care agencies are licensed by Medicare to provide the therapies, the PT, OT, and all that. Some don't have that licensure and they can only do the non-medical home care. There are some agencies that do both. The average cost in Southern Maine is $35 to $45 an hour. I know, it's crazy. Through one of these licensed home care agencies. And many agencies in the last few years, we've seen that they're going more and more to either daily minimum number of hours or weekly minimum number of hours. A lot of people call and say, well, I just want somebody to come an hour a day and give my mother her medication and make breakfast or whatever. They won't do that usually because it really isn't worth the agency's while to send somebody for just an hour. So you may find that you have to have a bigger block if you're looking for home care. SMAA maintains a database and can provide you with a list of these non-medical home care agencies, but we can't recommend or endorse any particular agency or service. And really, it all depends on who the agency has on staff. Does it meet the needs of the person in terms of days and times, and how does the worker and the older person get along? I mean, that's really more important than which agency you go with, because they all basically do the same thing and they cost about the same. So it really is a question of fit more than anything else. We keep track only of licensed providers, not private providers, because we'd have no way to vet them. I mean, we wouldn't want to recommend somebody who turned out to, be stealing the person blind or something. I mean, there are private people out there in the community. The best way really is to find somebody through word of mouth if you're interested in using a private person. And certainly paying a person privately, not through an agency, is less expensive. But you do need to think about, should you do a background check, insurance, so if the person gets hurt on the job, who's going to pay for that? Taxes, you're supposed to pay, I get that there are people that get paid under the table and no judgment, but you're supposed to pay, FICA taxes and all of that. So, that's what the agency does for you. So if you decide to go with a private person, you have those things to consider. And you really do want to keep very good records of any kind of home care in case long-term care, Maine care is ever needed, because there's that 5-year look back. So as of the date that you apply for long-term care, Maine care, DHS looks back 5 years. And they're going to see, especially if you have a private person working for you, they'll see checks to Sally Smith. Okay, who's Sally Smith and why are you giving her money? Because gifting is frowned upon. So, you have to be ready to show that Sally Smith got paid for doing certain tasks. I mean, if you go with an agency, they've got all those records, but not necessarily with a private person. So just something to think about. State-funded home care. So this is access through the state assessing agency, which is called Maximus. And there's the phone number. We don't assess whether the person's eligible for state-funded home care. The doctor doesn't get to say that the person's eligible. Everything has to go through Maximus. And they use a standardized assessment tool. They bring their laptops, their nurses. They go through a whole series of questions about what the person can and can't do for themselves. And that determines what, if anything, the state will pay for in terms of home care. They first do a screening over the phone. So unless you show that the person needs help with those ADLs, like bathing, dressing, toileting, that kind of thing, you may not get any further than that, because they're really looking for people who need help with those ADLs. That's sort of the bottom line as far as eligibility. And sometimes people want to make their loved one or themselves seem better. I think that's a human characteristic, to kind of minimize the help you need, but then you're going to get screened out and you're not going to get any help. So, and so then if the person gets through the screening process, then the nurse from Maximus will arrange to do a complete assessment of need, usually in the person's home. Although they can do them over the phone, especially if somebody's living in a different state and is moving to Maine, they can work that out. The screening focuses on whether the person needs help with those ADLs. People with progressive dementia who need extensive cueing to perform ADLs. They can do it physically, but they need help with somebody telling them each step. They may also qualify. Maximus assesses for a variety of different home care programs. They decide how many hours of home care the person is eligible for. And depending on which program or programs the person qualifies for, they may be required to apply for long-term care Maine care. So there are actually two different kinds of Maine care. So community Maine care is for people living in the community who have very, very low income and assets and use Maine care as their health insurance. Long-term care Maine care pays for facility care when the person has limited resources. But there's also a program called the Maine Care Waiver Program. So basically what it's saying is the person's at a nursing home level medically, Maximus has said so, and they also qualify for Maine care. And that's the home care program that will give you the most hours, generally speaking. Many programs, I feel like this is a theme, do have a waiting list for funding. The ones accessed through Maine Care, which is a combination of state and federal funding, do seem to have shorter wait lists, at least right now. To be honest, we don't know what's going to happen in the future with the new administration and with Medicaid and all of that, so that remains to be seen. But programs that are funded entirely with state funds, such as the home and community-based care program, last I heard, I spoke with somebody not too long ago who said they had just gotten off the waiting list and it had been 8 or 9 months, I think, that they had been waiting for funding. And the person may have a monthly copayment depending on income and assets. So at the time of the assessment, that will be discussed as well. But it could be that the person be asked to pay a certain percentage of the cost of the care. Veterans Administration, they do have a home care program. You must contact the VA directly. They've basically said to us, don't even try to suggest what the person might be eligible for through the VA. We want to talk to them directly. Because it's such a complex system. Lots of red tape, as with the government, but really depends on length of service. Did they serve in wartime? There's all these different factors. So we gladly actually say, you've got to talk to the VA directly because we can't speculate what you might be eligible for. But there's the number for the Maine Bureau of Veteran Services if you're working with a veteran. Long-term care insurance. So some long-term care insurance policies do cover in-home care, but each policy is different. So you really have to contact your insurer to understand, first of all, whether your policy covers in-home care, and secondly, how do you activate it? And you may need to pay out of pocket for a certain period of time before the coverage kicks in. So there's often a 90-day out of pocket or something like that before the long-term care insurance will kick in. So unfortunately we can't really help people to know what their policy covers. They really have to talk to the insurer, and it depends on how long ago they took it out and many other factors. But it can be a good way to get some home care covered. Just going to touch real quickly on different kinds of housing. So, first you have living in your own home or in an apartment. There also are places that we describe as independent living with services. An example of that is, oh my gosh, I'm going to totally blank on that name, Ashton Gardens in Portland, which has independent apartments, but they have like meals and some access to some homemaking services and that kind of thing. You pay more than you would for just an apartment, but you do get these added services. So it's sort of in between living totally independently and going to an assisted living place. Not covered under Maine Care, however. So the person would have to have the means to pay the monthly rent, which would include the services. Then you have assisted living or residential care, really kind of the same thing. I mean, Department of Health and Human Services likes to call it residential care, but to us, we call it assisted living. So where, you're still somewhat independent, but you need additional care, help with your bathing or meal preparation or, all these other things. And then you have nursing homes, which is the highest level of care in Maine. And it's really pretty difficult to actually get into a nursing home. Back 20, 25 years ago, there was really a push to get people out of nursing homes into assisted living level where they'd have more freedom and they didn't need as much care perhaps. But so nursing homes today really are reserved for the folks who need a lot of medical assistance or have severe dementia where they really need eyes on all the time. So so a lot of people start in assisted living and then might have to go to a nursing facility if their needs become too great. Sometimes they're on the same campus, assisted living in a nursing home, sometimes not. So adult day programs, not technically home care, but I think it can be kind of lumped in with services that you can get to try to be independent or to stay at home. So I thought I'd throw it in there. They are licensed either as medical models or social models. The medical models do allow administration of medication, so they have to have a higher licensure on staff, some CRMAs or a nurse to administer meds. But all of them are licensed by the state of Maine. They can provide relief to a caregiver of a person, particularly with cognitive, sometimes physical, but oftentimes these day programs are for people with cognitive impairment to go and do activities and socialize and have a meal and be safe so that the caregiver can get some relief. And these typically cost between $15 and $25 an hour. So not cheap, but less expensive than a home care agency, about half. So it's another option that you could consider, especially if the person has Alzheimer's disease or some other kind of a dementia. So, how do you learn about resources? Well, you can call us, or you can call the Agency on Aging nearest to where the person lives. Let's say you're concerned about mom or dad who lives in Florida. You can go to a website called the Elder Care Locator, type in the person's town or zip code, and it's going to show you the closest agency on aging. There are agencies on aging in all 50 states. They may be called something different, but they act as a clearinghouse for services and supports for older folks. You want to take stock of your complete financial situation, or if you're the caregiver, let's say of your parents, you need to have that conversation with them. What do you got that we can work with here? I know it's a conversation that makes many families uncomfortable, but you really need to know what you're working with so that you know what you can afford going forward. The cost of in-home and facility care comes as a shock to many older adults and their families. Elder care is incredibly expensive, not just in Maine, but everywhere in the United States. And financial assistance may not be immediately available, so planning ahead. I sound like a broken record, but planning ahead is crucial. We talked about the cost of non-medical home care. If the person needs assisted living or residential care, it will cost approximately $5,000 to $8,000 a month. A memory care facility may be $7,000 to $9,000 or more. A nursing home is going to probably be well over $10,000 a month. These are incredible figures. There is possible assistance through Maine Care, but the person must spend down their own assets first. If the person who needs care must go into a long-term care facility, there are protections for what's called the community spouse. So if it's a married couple and one is still going to be living at home, the government does not expect the community spouse to become impoverished paying for the long-term care of the spouse. So a certified elder law attorney can be invaluable for that kind of financial planning, to understand how you can divide up the assets and who can keep what and all of that. So, we would suggest if there's, any significant assets, or if there's a spouse still living at home, we would recommend sitting down with an elder lawyer. We can provide a list of legal resources and elder law attorneys. Can't recommend or endorse, but they specialize in the complex laws surrounding Maine Care and financial planning. And it is important, especially if there are significant assets, spouse still living in the community, or this one happens a lot in Maine, a secondary property such as a family camp. So that can get really tricky when somebody's trying to access Maine Care, but they own a part or all of a camp that's not their primary residence. So that's where you need to get a lawyer involved. It is possible that some assets can be protected from consideration by Maine Care, but it is critical to use an elder lawyer to avoid problems with that 5-year look back. It's really not a do-it-yourself kind of a thing. And there are potential penalties for transferring assets, except in very certain circumstances within that 5 years. And so the person could be ineligible for Maine Care when they need it, if they find that they've given away or transferred anything of value. I know it's all pretty overwhelming. What does SMAA do? Well, we can help with information and resources. We have nutrition programs, health insurance counseling. We have wonderful, Mary used to oversee our Medicare volunteers who are highly trained and can help people understand the options when it comes to Medicare. We have our Money Minders program, which is to help people write out their bills, not take over their checkbook, but write out the bills, keep track of what they have to pay, that kind of thing. The phone pals that we talked about. Family caregiver support, that's my department, where we're trying to support the caregivers. We do run right now 2 adult day programs, one at the Cohen Center in Biddeford, and one a new one in Springvale at the Anderson Learning Center. We've just opened that hub. And there's a new office coming in Portland, but not for a while. Well, there has to be some renovations done, but it's on Outer Congress Street, so keep an eye out for them. And then we have our Age Well programs, so that's Tai Chi, Matter of Balance, those kinds of things. I'm running on too long here. Just real quickly, that's what we do in family caregiver support. Things like options counseling, individual and group support. So we do support groups. We do run the state caregiver respite program, which can help with a little bit of the costs of respite care if the person qualifies. And we do educational classes. So that's kind of in a nutshell what my department does. That's that. So our main office right now is in Biddeford on the Barrow Road. But there's our number, and you're certainly welcome to call it.